when I started Doc and incorporated it in Florida as Doc Inc., we wondered what the name would stand for. And because I always loved the notion of when I was growing up, my father was always called Doc. Hey, Doc. We'd go everywhere, and it was always, hey, Doc. And one of the people who had expressed interest in my announcement that we were going to hold a get-together at Jackson Hospital to start the group to counteract bad health habits in the community, and especially smoking, was a psychiatry resident. And we set up an evening meeting in our apartment in Miami, and and we were going to have the only other people that I could find. There was a resident, Betty Widman, and also one of our faculty members, Elliot Podol. And we were going to sit around and talk about articles of incorporation and how you did this and what we were going to try to accomplish in creating a speakers bureau for the schools. And this other fellow was going to join us. We were expecting a few people, but only a couple of people did show, and the psychiatry resident didn't make it, but he did call. And he said, my wife won't let me come because when she heard what I was going to do with this anti-smoking group, she said, now remember that patients in psychiatry smoke a lot, and your department uses it as reward behavior, and you're going to go against that, and it's not going to be good for you if you start, lecturing on smoking when so many psychiatric patients depend on smoking. And so you might be perceived as trying to not help them. But he did say that she thought of an idea for what DOC could stand for, and how about doctors ought to care? So at least, although he didn't join the organization, I do credit her, whoever she was, for the name Doctors Ought to Care. And as we were there in the evening talking about what we wanted to do, the phone rang. And it was a fellow who said, hi, my name's Ira Kurzban, and I'm from this free radio station. I think it was WDNA. And it's we're a radio station that's got a very small wavelength, and it's all by the people. It's just a group of us who are trying to get out opinions that are not aired in any other medium, and we really like you to contribute to Radio DNA. And I said, excuse me, I'm in a meeting here, and I was just annoyed because I couldn't get him to stop. And I said, could we talk another time? I mean, he said, well, what's your meeting about? I said, well, if you really want to know, we're trying to organize a group to combat smoking and the other killer habits. And he says, oh, really? What's that all? What's it called? I said, well, we're calling it Doctors Ought to Care. I said, really? He says, yeah. He says, that sounds great. He said, and when did you start? I said, we're starting it now. He said, oh, well, can I contribute to? Well, this has to be the only recorded case of someone calling up and asking for funding, winding up sending me a check for Doctors Ought to Care. And that was Ira Kurzban. We became close friends. Ira became our lawyer, and he filed the Articles of Incorporation. And it was just a really funny kind of way to meet. And one of the first things that we wanted to do was to buy advertising space in the mass media. This was going to be the difference between public service ads and the way you really reach people, which is to buy your space and call your shots. And you get to be the person, whatever it is that you want to say, as long as you're paying for it. He who pays the piper calls the tune. And I knew this would be expensive, but I knew that, as I would learn many years later from Tony Schwartz, that what are public service ads? They're the ads that are on at 2 o'clock in the morning telling kids not to take rides with strangers when the only people up at that time of night watching are the strangers. So the articles of DOC and the objectives were to educate the public, especially young people, in refreshing ways about the major preventable causes of poor health and high medical cost. Number 2, to tap the highest level of commitment of every health professional in this goal. Well, actually, number 2 was to tap the highest level of involvement, of creativity of every student, so that if a child could draw, we'd try to get them to do posters. If a child could do music, we'd get them to do a jingle. if the Tala could do photographs, we want them to photograph things. We wanted to get people involved to counteract the killer habits. And the fourth was to purchase advertising space in the mass media for these ideas, these posters, these commercials, whatever it was that the kids would help us come up with. And fifth, to use humor, satire, and ridicule. So really the five principles were what we stuck through the entire 25-year history of Doc, and to really purchase counter-advertising space, to tap the highest level of commitment of every physician, to tap the highest level of creativity of every student and young person, and to use humor, and actually the fifth one was to do brand name imagery. So we weren't just talking about don't be a stupid owl, be a wise owl, and don't smoke. But I think that the key thing is to talk about Marlboro and Winston and not talk about smoking, nicotine, or lung cancer. And one of the places that I thought we would get the biggest bang for the buck was on billboards. And I wanted to purchase a billboard to talk about what we wanted to do to laugh at the Marlboro Man. And I called up the leading billboard company in Houston, and I said, I represent a new doctors group. We want to buy some billboards. And he said, "Oh, doctor, that's wonderful, wonderful. That's terrific, doctor. What'd you have in mind?" I said, "Well, what we want to do at first is we want to have some billboards to counteract smoking." And there was this long, long pause. And he said, "But what do you mean, doctor?" I said, "Well, this is the number one cause of death, so we really want to get up on some billboards to counteract smoking." And then he thought quickly and he said, "Well, doctor, you don't have to pay for that kind of space. We can get you a public service space. We can do Don't Smoke Kids. Yeah, we'd be happy to do that." I said, No, you didn't understand. I want to buy the space to do my own ad in our words, not what a public service is. We don't want a generic thing. We want to do very, very specific kinds of ads. And I think I led on to the kind of things to talk about brand name parody. And I could tell this guy was wanting to get me off the phone as quick as he could, and said he would send me a packet on the public service ads, and that was about it. But by no means would he ever be a part of what we were going to do, because he all but said they would have to consider this, and they were not about to, that he reminded me that they don't have to take these ads that we were going to do. And we were stonewalled by the company, and somebody gave me the idea to call the bus bench company. I must have just been driving around. Bus benches were at every bus stop. They were just literally wooden benches, and I saw them, but everybody I saw and talked to, they said, "Oh, nobody sees bus benches." And but who would you be reaching? You'd be reaching the people that take mass transit, that have lower incomes, and that's who I wanted to reach to begin with. And I saw the phone number on the bus benches, and I called, and I was put in touch with a fellow named Jack Waxenberg. And I told him my idea. We'd like to buy some bus benches. I represent a physicians group. We want to counteract the cigarette people on cigarette companies on billboards, and we haven't been having any success in buying billboards, so we want to buy some bus benches from you. And from the moment we first spoke, he thought it was a great idea. He wanted to assure me he would give me a really good rate, and these would be individually paid for, such as like about $25 a month for each bus bench. But, these were hand-painted, and we would get about 30 of these bus benches all over town. And the first money I raised for Doc went for about 30 bus benches all over Miami. And the first message on them was Country Fresh Arsenic. We tried to place them opposite Marlboro ads, which had Country Fresh, which had, Welcome to Marlboro Country. We also found Salem ads that said Country Fresh Salem. And so we would try to juxtapose the bus benches. And again, while everybody advised me, don't do this, nobody sees bus benches, as soon as these bus benches went up, I started getting calls. Actually, some of the early calls were, all it said was, Country Fresh Arsenic, love Doc. And we got irate calls, you didn't put the warning. Where's the warning? So they thought these were real ads. And it was astounding how much attention we got. There was a paper on Key Biscayne that wrote about it. In fact, from their angle, they thought the bus bench might be illegal. So they questioned whether we had a license for the bus bench. But that wasn't really our problem. That was the bus bench companies. And the Miami News did a major photograph of it. And eventually we were getting articles all over the United States about this. And by this point, Rick Richards I'd met him in Kansas City. And he was off. His earliest efforts was a bus bench in Spartanburg. that spoofed a brand that talked about it came in an iceberg, and that was ridiculous. So he said, guaranteed to make you cool as a corpse. And so these were the kinds of images that we were doing, and bus benches turned out to be really an opportunity to share this all over the country. People could do this at low cost in their neighborhoods and their venues, and we had a lot of fun. Decade, the taste that took 10 years to make became emphysema, the disease that takes only a decade to make. And we had full-bodied cyanide. We had 10-year supply, only $7,000. We placed these also opposite the Veterans Hospital. One of the bus benches said smoking and smoking and hospitals don't mix. What caused that $10,000 fire at Jackson Memorial Hospital? And we placed that in front of Jackson, and they tried to get the bus bench removed. But we'd heard that there had been fires in hospitals, and this did not sit well with the hospitals to have to ban smoking. And so this bus bench succeeded in getting under the skin of even the health community. But as a result of that, WTVJ Miami, the CBS station, interviewed me. The reporter was Bob Jackson.